Well, now let's take a step into the future, sort of, with a look at what our next guest describes as the world's first artificial intelligence hybrid therapy model. And this is an exclusive first look at this.
An exclusive and years in the making. So you can see a bit of how the program looks right here. The model has been developed by the company Anonymous Health. They claim it incorporates an AI assistant that works directly with licensed therapists to help patients across the U.S. battle addiction and mental health issues.
And we have the CEO and co-founder of Anonymous Health, Geoff Nudd, here for more. Geoff, good morning. Thank you again for giving us this exclusive look. I'm absolutely fascinated by the work that you're doing. As Sam said, a long time in the making. 12 years you were working on this model. And I think people will be a little maybe hesitant to latch onto the idea of an AI therapist in any way. But what you're actually doing, right, is like AI is kind of like training with someone's therapist. Explain how that works, how it works behind the scenes and what it looks like for a patient.
Yeah, for sure. So first of all, addiction is arguably the #1 health problem in the United States. 1 in 6 U.S. adults is struggling with addiction, which means it affects just about every family, certainly every community. And our solution combines a world-class full clinical care model with an AI therapist assistant that supports the therapist during the session. So we're not just talking about helping the therapist with documentation, but our therapist assistant will actually carry the weight for 5, 10, 15 minutes, running through therapy exercises, things like mindfulness, content. So for that 5, 10 minutes, it's actually supporting the therapist. Huge impact in an environment where we have a lot of therapist burnout and we're losing folks that can help to this population. And then third, helping patients at times of risk. And what do we mean by that? Maybe, for somebody that's struggling with alcohol, 2 o'clock in the morning tends to be when they wake up and their mind is going. They're thinking about that thing that's happening at work or with their family or some past trauma, and that's when they grab the painkillers. Well, there's no way that a therapist can reach out every night at 2 o'clock and help, but AI can. And it's having just an enormous impact on patients' recovery outcomes and therapist burnout.
Okay, so you've outlined one of the main questions. This is supplemental. It's not a replacement for actual human interaction. And you said off hours, someone might just want feedback. But what's the level of trust, I would really want to know, for patients when they access this kind of technology? It's not a real person.
Well, I'm so glad you asked that, because you're right, it's not a real person. And, if you think about how AI interacts with patients, in the wild independently, there are real concerns about, just a few weeks ago, saw a story about how some of these LLMs being used for therapy are being sycophantic. They're telling people what they want to hear. And that's great if you're trying to keep somebody engaged, not so good if you're trying to help people get better. And that's why our approach of integration to a full clinical model, what do I mean by that? I mean one-to-one therapists, nurses that are prescribing medications to help with cravings or anxiety or depression, that peer support. So a world-class clinical model with the AI therapist assistant. And that therapist assistant is acting at the direction of the therapist. The therapist is telling it, hey, I want you to do this kind of screening so we can measure how you're doing. I want you to run through this ABC thought record exercise that's going to help you reframe some of the negative things that are going on. So it's actually content directed by the therapist, not just an LLM in the wild. And so profound impact on helping that therapist carry some of the weight. But then we're seeing extraordinary patient outcomes as well.
Okay, let's talk about outcomes. Here's a stat. Your company says you're achieving 60% rates of abstinence at the 6-month mark. That is more than twice the rate of traditional approaches. Do you attribute that success to the assistance of AI, to what it is sort of allowing the therapist to be able to accomplish?
Yes. Yeah, I think it's 2 really big drivers. One is we make it possible so that when somebody needs help, they get kind of a bear hug from our clinical team all at once. So they're not trying to piece together a solution. They're getting the therapist, they're getting the peer support, they're getting the medications that can help with things like cravings. So it's that full clinical model, and that's part of the driver of the outcome. But then it's all those touch points in between appointments that really are having an impact. And where we're seeing that make an impact is things like show-up rates at appointments, particularly in the low-income population. Our show-up rate at appointment is 40% higher than industry averages. So if you can keep people engaged, if you can keep people showing up at their appointments, it has a profound impact.
That is incredible. And also, I'm struck by something you said at the very beginning of this interview, that there are so many families, I think you said 1 in 5, 1 in 6, that are affected by addiction. And when that does happen, and many of us can relate to this, friends, family, everyone gets involved, right? So there's a lot of human interaction.
That's exactly
It affects everybody. And yet, are people at all concerned about placing their trust, even if it's supplemental, in the technology aspect of this versus the empathy that you get from friends and from family?
I don't think it will ever replace the empathy from friends and family. I don't think that's the job it's going to do. But I do think it helps the therapists carry some of the load, and I think it helps the patients at those times when maybe their family can't be there. And I'll take just a moment to talk about the therapist burden. I had a therapist a couple of weeks ago tell me, Geoff, I'm listening to 6 sad stories a day. My day is organized into a 50-minute burst with a patient, a 7-minute break, and then do it all over again. And these are really tough stories for folks that have, say, addiction and are using that to cope. And having 7-10 minutes where the therapist assistant, the AI therapist assistant, is actually carrying some of that weight, times 6 appointments per day, can make the difference between that therapist saying, you know what, I just can't keep doing this anymore. I have to drop out of the workforce. You know what, I used to be able to see 25 patients every week. Now I can only see 15. And so the impact on therapist burnout is profound and ultimately extends to hundreds of patients over time.
Something I think many of us wouldn't have even thought of, the trickle-down effect of this.
Geoff, really incredible work. And it's neat when we can talk about these ways that AI seems to be having a really positive impact. We should say, while we're talking about this, if you or someone you know needs help, please call 988, the Suicide Prevention Lifeline. Geoff Nudd, thank you so much.
Yes,
Great to meet you.
so much.
Great to have you with us.